2,500 employees. When you think about the Department of Children and Families, you probably first think about the child welfare system. Critical, important, foundational area, one of the most foundational roles I think that that's involved in any state government service, including child protection, foster care, and foster care licensing, adoption, and more recently, a focus on prevention services. That's not all that DCF does. We also manage an entire array of benefit programs, cash assistance through the TANF program, food assistance through SNAP, child care services. We also manage adult protective services and child support services, a huge income support for Kansas families, as well as the work programs that happen through vocational rehabilitation services for individuals with disabilities seeking to enter the workforce, and the work programs that we provide for individuals accessing our cash and food assistance and child care benefit programs. You know, DCF, the vast majority of our employees are spread across the state. They're in our offices in 36 counties in the state, doing this direct service work, this direct benefits work. By contrast, the Department for Aging and Disabilities has just under 300 employees. It has a much larger budget than DCF because at KDADS, we manage the funding for the state's nursing facilities program and all of the home and community-based services Medicaid waivers for persons with intellectual and developmental disabilities, physical disabilities, the frail elderly. We also inspect and license adult care homes and also serve as a single state agency for mental health and substance abuse services, working closely with our community partners around behavioral health. In conjunction with that, we also manage the 4 state hospitals, 2 psychiatric hospitals at Osawatomie and Larned, 2 IDD hospitals, KNI and Parsons. Most of those 300 KDADS employees are scattered across the state doing that survey work related to our adult care homes and nursing facilities. And then the rest are in Topeka within our central office. And then obviously we have about 2,300 in those state hospitals as well across the state. So again, the new agency would combine these 2 agencies into a Department of Human Services. You can see on the bottom of page 4 a listing of the programs that would be in the new agency. Again, I've already said many of those. I won't repeat that. I think it's more important to talk about just the vision for the new agency, why I really believe strongly that this is the right direction to go, and what we will achieve by consolidating these 2 agencies. You know, one of the things we know, and as I came back into state government a couple years ago, I was just really reinforced in understanding this and looking at the data about the large crossover population of customers that DCF and KDAD serve. And just the matrix of services that customers have to journey through. And today, that's a fairly complicated and burdensome journey. There's not a single local touch spot across all of those services for individuals and families to navigate. So I strongly believe that allowing families to be able to access services more easily, more streamlined access, more ability to navigate those supports will also help us then to provide those supports and services more earlier before a crisis takes place, and really be able to assist in a whole person way. You know, I also believe, and I'll talk about these a little bit more individually, that the ERO allows us to continue our focus on prevention. You know, prevention is so critical if we're going to support individuals and families from moving deeper into systems. Again, enhancing service access, and then I also believe a really strong piece is growing stronger connections with our communities and our community partners across the state. You know, to be successful, I think we really have to understand the full frame of a family. You know, very few have singular needs. People don't live in silos. I mean, think about your own experience in your families. And often within either of the agencies will work with a family, but they have other needs. There may be multiple needs. We may be working with a family with a young child who needs assistance in developing parenting skills. Perhaps they, at the same time, need supports and assistance to help their aging parents stay successfully in their home. You know, currently, these families navigate multiple agencies and workers. By creating more of a one-stop human service hub, the same family can receive services more efficiently and can more effectively receive linkages to other services and supports that they might need. It's really about, I think, looking at families holistically. You can see the image on the bottom of page 5, where I really have a vision that we can really use the existing DCF service centers, those 36 service centers across the state, as resource hubs for individuals and families, and provide more integrated service delivery to those families. So again, that same example, perhaps a low-income mother comes in, perhaps is looking for some food assistance through the SNAP program, but perhaps their child is struggling with some mental health issues. And they may be, again, having some issue with an aging parent. I think the ability to work effectively with all of those factors that are impacting the success of that individual, being able to either provide those services directly, make those warm handoffs, have a bit more of a case management approach to individuals seeking those services and supports. You know, a number of years ago, I think it was under the Graves administration, when I was at SRS in an earlier part of my career, and I think really had just gone over there, and we had a concept within SRS, which was a very large human services agency, larger than what this is proposing, of what we called at that point integrated service teams. We're at the local offices for those customers who really had those multiple complex needs. There might be a benefits worker, a person helping with employment. If there were issues related to mental health or behavioral health, we actually had mental health and substance use persons on the team within the local office who, again, could help work with and support that family. So again, the idea of a resource hub, more streamlined access for families. Let me give you maybe another practical example of how a combined agency can serve our clients more effectively. You know, I mentioned earlier that KDADS, manages the 7 home and community-based services waivers. You know, those are Medicaid-funded programs that allow individuals to stay in their homes and communities. People with physical disabilities, intellectual disabilities, the frail elderly, just as an example. At the same time, you know, that KDADS is managing those programs, DCF runs Adult Protective Services. And we know from looking at our data that a significant percentage of all of our APS investigations involve individuals who are receiving those home and community-based services. 20% of all of our APS investigations, and 27% of those assigned for further investigation have to do with HCBS clients. I have given you some additional stats within there as well, but bringing the two agencies together would really be beneficial to the health and well-being of individuals on those HCBS waivers. Providing HCBS better access to the APS investigations, better data sharing for the health and well-being measures we need to provide to the federal government, but most importantly, how that client benefits the safety and well-being of that individual. You know, I talked there about protection. I could have talked about nutrition across the agency as it relates to, for example, the SNAP program and increasing access for the elderly to that program. I could have talked about employment, whether we're talking about employment for persons with disabilities who want to go back to work, whether we're talking about foster care, whether we're talking about persons receiving our benefit programs. And maybe most importantly, just the thread of behavioral health and addiction that touches so much in our society, and certainly the populations that we serve at DCF. Another piece I wanted to comment on, in addition to making it easier to navigate the bureaucracy for our client, is just continuing the focus on prevention. You've heard a lot in the legislature over the last 2 years about Family First in the child welfare program. And we very much appreciate the legislature's support for Family First. And it's been a very successful program. In the first year of the program, more than 90% of the families did not have a child enter the child welfare system. You know, important, successful program. At KDADS, we also have a strong history of prevention. Really, Kansas has been a leader in the nation in the area of prevention in substance abuse for many, many years. And one of the things I think we know about prevention, and when we think particularly about kids, is there's common risk factors, there's common protection factors, and I think working more effectively together on an outcomes basis to really impact those prevention efforts, again, to catch families and individuals earlier, to really help families not get too deep in the system, but also build family and community resiliency. You know, the last thing I would say, and we had some of these conversations last year, and I recognize this ERO creates a large agency. One of the questions that comes up with that are questions about efficiencies or cost savings. You know, while it's certainly not the primary reason to combine the agencies, the better service, the streamlined service, the enhanced focus on prevention are really the most powerful reasons for combining them. You know, I do acknowledge that through this combination, we will have some opportunities for cost savings. For example, you know, eliminating some existing leases through co-locating, eliminating some common administrative leadership positions, some things like that over the course of the next couple years. And my team has identified about $1.1 million when those pieces will be fully implemented. But I think the real savings are frankly the ones that we can't quantify. They're about providing those supports earlier. They're about more efficient service delivery. They're about providing that assistance before a crisis. And that doesn't mean we won't have ways to measure that. I mean, we have significant outcome measures across all of the programs that we manage. We'll be able to report those outcome measures and see the effect of the combined agency. You know, I wholeheartedly believe this reorganization is the right thing to do. You know, I've been doing this work a long time. I've done it in a great big human services agency. I worked for the Federal Department of Health and Human Services for a couple years in the regional office in Kansas City and then came back here. And I think one of the reflections I had in coming back was that when the agencies were torn apart, that really created fragmentation for individuals and families. And I really believe we can more effectively serve families, not just make it easier for them to access services, but be more effective in the work that we do with families. The last thing I would say is we can't achieve this vision by ourselves. You know, the work we do, it can't be done in isolation from the work done by our human service partners and frankly by our local government partners. You know, the counties are the human services arm of local government. And I frankly think that we need to be working more closely with them regardless of what happens with this ERO. But I think that a strong value of this executive reorganization order is organizing state efforts in concert with communities towards a more integrated system of service delivery, thinking about common outcomes, being able to think about investments together, and recognize too sometimes, as we all know, the critical human service issue in one part of the state at a given time may not be the same as a human service issue in another part of the state. And I think the ability to be more focused on those common outcomes through being more engaged through those resource hubs across this array of services will serve all of us well across the both state and local governments. Because ultimately, it's not just about individuals, it's about communities and the strength of communities. So I really believe this is about smarter and more efficient government. It's about better access, more streamlined access to services, and it's about collaborating with our local partners, all for the purpose of success of people. So thank you, Mr. Chairman. I rushed through that a little bit. I know you don't have a lot of time this morning, but I wanted to leave some time for questions.
Thank you, Madam Secretary. And if you can stick around, we'll try to get through all the proponents and then hold questions till the end.
Thank you.
Thank you. Next up, we have Sean Gatewood. He's the co-administrator for Care Advocates Network. Sean, welcome to the committee.
Good morning, Mr. Chairman, members of the committee. Thank you for allowing me to testify today. My partner and I administer a group called the Care Advocates Network, and we seek to represent all those served by the Care program. We are in support, we rise today in support of this ERO, and despite if this ERO passes or not, we are in support of some of the basic concepts of the ERO, and I want to kind of go through those today. One of the biggest things we lost back, I believe it was ERO 41, I reference it in my testimony, back when SRS was split into the current system, is sort of the local agency, local state support for people with disabilities and seniors, particularly in the area of Medicaid. So the application assistance to help guide folks through the system, that's no longer there, at least not as a state agency anyhow. And that is proved to be challenging at best in some circumstances, because people, when they encounter that, if you're trying to enter the system because mom is no longer really functioning at home well and she almost burnt the house down, you're really in crisis. You're needing help right now. And there's that application assistance to get on the FE, the Frail Elderly Waiver, it just doesn't exist. And so having that local assistance is probably one of the biggest reasons that we're in support. Also, the marriage of the APS, as the Secretary talked about earlier, with sort of being in the same offices as those that are administering the HCBS programs, because so many of those reports are substantiated and come from HCBS clientele. We believe that there's a tremendous amount of potential there for efficiencies and not only finding where we have problems, but also getting these folks, when they have an issue, sort of back up on their feet, getting them the transportation or nutrition assistance or whatever it is, all under one house to support them, again, living in the community where they have the greatest freedom to live their lives. We think that that'll lead to greater outcomes. Also, in the world of child advocacy, foster care and children's mental health, access to community mental health services, again, seems to have a tremendous amount of potential to improve the outcomes of those cases. Again, trying to prevent those families that are, again, in crisis from going deeper and deeper into the system by catching them earlier seems to make a lot of sense to me. So, again, we just rise in support today for those various reasons. And again, whether or not this ERO passes or fails, we are happy to continue to advocate for a better marriage of those services, as we have with this administration, previous administrations, and legislatures. So thank you very much for the opportunity, and I'll stand for questions at the appropriate time.
Sean, thank you very much. Committee, next we have Michelle Ponce, Association of Community Mental Health Centers of Kansas. She is filling in for Kyle Kessler today, and she is attending virtual. So Michelle, welcome to the committee.
Thank you. Good morning, Mr. Chair and members of the committee. Again, my name is Michelle Ponce. I'm the Associate Director of the Association of Community Mental Health Centers of Kansas. Our association represents all 26 licensed community mental health centers across the state who provide services in all 105 counties. CMHCs provide community-based mental health services regardless of ability to pay, which really makes them the safety net for Kansans for mental health needs. We appreciate the opportunity to provide testimony this morning in support of the Governor's Executive Reorganization Order number 47 to consolidate the Kansas Department of Aging and Disability Services with the Department for Children and Families into the proposed Department for Human Services. CMHCs currently work with both KDADS and DCF very regularly, along with multiple other state agencies, including Health and Environment, Department of Education and Corrections. This results in a significant amount of government coordination, and that's because the programs they administer are so inherently interconnected. And kind of echoing Secretary Howard's testimony, it's not just about reducing the number of agencies. It's really about providing more effective coordination of programs to enhance the services for the people that we and those agencies support. For example, a child or family that is engaged with the child welfare system is rarely only engaged with the child welfare system. That same family often connects to or needs to connect to across other programs like mental health or IDD or substance use prevention and treatment, child support enforcement, or that family may really need assistance with childcare or employment. Having administration of these programs under the same umbrella enhances both coordination and inherently supports a more integrated approach to meeting the needs of those individuals and families. And in closing, just thank you again for the opportunity to provide testimony in support of the ERO, and I'm happy to take any questions at the appropriate time.
Michelle, thank you for your testimony. Committee members, I would draw your attention to the written only proponent testimony. We do not have any opponent or neutral at this time. And so at this time, we will open up for questions to any of the conferees. Madam Secretary, I do have a couple of questions for you real quick. My first question is, I had heard, I haven't looked into it in detail, but I had heard that the governor's budget proposal cuts funding for the Osawatomie and Larned bed space. Is that accurate?
Mr. Chairman, I think what you're referring to is that the governor's budget as issued reduced bed capacity for the next fiscal year at Larned in two programs, the Psychiatric Services Program and the State Security Hospital Program. She has since issued a governor's budget amendment this week that would restore that funding back. I mean, I think the context for that is we had made some reductions in bed capacity at Larned related to COVID, related to needing to create some isolation units for COVID. The governor's budget had initially continued those reductions through the next fiscal year. Her governor's budget amendment restores that bed capacity. So at this point, there's no reduction in the governor's amended budget.
When does the governor's moratorium, when is that going to be lifted?
In terms of the moratorium at Osawatomie, later this year, I would say initially last year, we had talked about our planning was to lift it in June or July. I think realistically, given some delays in construction in Osawatomie that have also been delayed to using some bed space for isolation in COVID, we're probably more later into the fall, but we're well on the way to the pieces where, for example, some of the pieces connected with that are beginning to contract for some regional beds across the state. We worked through all the elements with Medicaid for, how those are paid for, all those infrastructure sorts of pieces, and we should be ready to announce some of those bed spaces within the next few weeks. And we think Prairie View has been the first entity that's come on board as what we're calling a state institution alternative. So as we get more of those contracted regional beds on board and get the bed space at Osawatomie expanded as you recommended last year, later this fall, I mean, realistically.
Thank you. Committee members, do we have any more questions for any of the proponents? Senator O'Shea.
Thank you, Mr. Chair. More of comments. I think in general, I think this is a positive change. I'm excited it's happening. I am slightly concerned when I look at a lot of the testimony, and from what I'm hearing, I'm not hearing a lot about aging services, and I think I've been disheartened through this pandemic to see some of the aging services in our nursing homes have had challenges that have almost been minimized. And I think about our aging population will only grow with the boomers. And so I don't want to see any of that negatively affected. If anything, it needs extra attention and care right now. So that's a bit of a concern. But I believe in whole person care and lifelong human development. And so I think in general, I think it's positive.
If I might just comment on that for a moment, Senator. Part of our thinking, even in terms of the reorganization, is right along the lines that you've been talking about. about, even within, for example, our central office in KDAS right now, all of the, really, almost all of the resourcing connected to nursing facilities is just the survey and certification function. It's clear we need more program capacity on the aging side, and as we've done some thinking about how we might reorganize staffing and pieces, that's an area we want to enhance centrally. And then also locally, obviously, having the DCF regional offices be able to be a bit of a resource hub there as well, I think would be positive in having stronger connections at the local level with the AAAs and other aging partners.
One other comment, I think just, and this is true with any organization, but merging staffs and cultures and just being aware that produces its own challenges and time and I guess just encouragement. My job is to help companies do that. So it take time and attention to, make sure everyone's on board with the new vision and working in harmony. Thank you.
Thank you, Senator. I absolutely understand that. I spent 3 years at the KU Public Management Center doing some of that similar kind of consulting. Culture is the key to the success of a reorganization.
Senator Gossage.
Thank you, Mr. Chair, and thank you for being here, Madam Secretary. Did I understand you to say at the beginning of your testimony that you oversee both of these departments?
I do.
And
I'm
how
the
long have you
secretary
done-
for both.
And how long have you done that?
Since the beginning of the Kelly administration.
Wow, okay.
And again, part of that, Senator, was obviously the governor's vision to bring those back together.
I see. So what have you seen personally that, and I read your testimony, and thank you for being here to give us even more input on that. But personally, what have you seen, having run both of these departments, that you feel like is most crucial in combining them?
In terms of most crucial in combining them, I think one of the areas that I continue to think is one of the most critical areas, and I alluded to this in my testimony, I think has to do with kind of the intersection of the behavioral health services, the mental health and substance use services, as we think about all of the populations that are served by both agencies. Such critical issues that impact so many individuals and families across the state. So that's probably the area that I focus on the most. And I think we've had a good example of that in the context of the child welfare system. We recently settled a class action lawsuit that was filed against the state in 2018. And one of the areas had to do with access to mental health services for kids in the child welfare system. And that's been an interesting process. Just working across the two agencies that I manage to affect all of the changes that we need to affect across not just the child welfare system, but the mental health system to meet those class action requirements, and also just to provide the services and supports that those youth need. So again, to me, that's been a very kind of highlighted example of how we could work better together as a single agency. And it would have been easier to accomplish those common outcomes and changes under a single entity.
And one final follow-up, do you see this as they would still, even though you would be the secretary over both, but you're combining them so that you wouldn't kind of see them as still two separate agencies, you would see it as one, so not separate directors for each, even though you would be the figurehead, but it would be one large agency, correct?
Yes, it would be the Department of Human Services, and it would be one of the things I always think is important when you think about reorganizing. It's not just about bringing all the deck chairs together onto the same deck. Just even the things I've talked about, how we would manage behavioral health services organizationally, how that might look different. The aging services, how we put some different resources and supports there. So it would not just be, here's this org chart and this org chart, now they're under human services. You would see changes across those. Thank you.
Committee members not seeing any more questions. We will. Senator Thompson.
Thank you for being here, Secretary Howard. I think, I was part of the folks that heard it last year, and one of my big concerns is when you combine an agency like this, the accountability, responsibility, you got a big budget. And one of the challenges we've had this year is getting information out of the Department of Labor, considering all the problems that they've had. They've been unresponsive, very difficult to get information out when there are crises. And I see, with the challenges in mental health that we have these days, I would say that some of these would be considered similar crises with the old folks being in the nursing homes and things like that. How would you address access and oversight in terms of, how are we going to get satisfactory responses from this new large agency that where we can have an impact and say, you've got a problem, you need to fix it. We've had those same issues with Department of Labor. We're trying to address those problems and we're getting nowhere. That's my big concern. You get a giant agency, everybody closes up when there's a problem, and the legislature is blocked out from trying to make any kind of changes that are, significant. So how would you address that?
I think anytime there's a reorganization, there's always an important oversight role for the legislature, and I believe in that strongly. Maybe it's partly just because I started my career at legislative research and spent 10 years there. So, that was my first lens for government, right? So I think there's always an important oversight role, but I would expect with a reorganization that we would be reporting really a number of things next year. Obviously, we would be reporting ways in which we have moved reorganization of the agency. We would be reporting key outcome indicators across the program area so you can see the movement in those outcomes and indicators. And we report those now. But I think it would be important to be able to call out where are those critical things where we really believe this reorganization can move the needle, and report those back to you and have you be able to see what that looks like from year to year, from month to month, over that period of time. I don't believe that there's anything inherent in a large agency that means that it has to be less responsive. I would still have the same kind of structure in terms of the kind of legislative liaison functions that I have, the communications functions that I have, I certainly would pledge to you, Senator, transparency with that.
Senator Baumgartner.
Thank you, Mr. Chair. Thank you for being with us today, Senator Howard, Secretary Howard. I do think that we need to have more information with regard to mental health, specifically with what isn't happening in our state facilities. I did a quick scan to see what has been made available just in the media, and the most recent is actually October 10th, 2020. We're not getting accurate, timely information with regard to what isn't happening and what the plan is, particularly with regard to the moratorium with Osawatomie. What we continue to hear from local law enforcement, as well as our community hospitals, is they are overly stressed because they are having mental health, what really should be mental health patients, are being kept in our jails and are being kept in our waiting rooms. And I would urge that you provide what you see as a truly accurate plan. We know that you and the governor had a press conference at the start of 2020 about what that plan was going to be for the state mental health facilities. And we do need an accurate, timely update, because those of us that reside near or within the districts of those facilities are pummeled weekly. We're pummeled weekly, and they want to know why the legislature hasn't done something about it. We do not receive updated information. We do not know what that plan is, and every time there is that drip of well, we're going to do something to lessen the burden, it doesn't come to be. And I fully understand, COVID came about, and that impacted things, but actually what that did in Osawatomie, Larned, other facilities, is it dropped down that capacity. And I understand that was partially due to isolation, but I can tell you, the next biggest issue came from Osawatomie State Hospital employees because they weren't receiving COVID tests, or not tests, but vaccinations. That finally got resolved, but they, instead of being at the front of the list, we had to clamor to try and make sure that they got on the list. My second point happens to be with regard to foster care. You and I have had many conversations. The chair and I served on the joint committee that met, I believe it was 6 or 8 separate sessions. And during that time is when it came out, not during our hearings, but it came out from news stories that were published by the media about the problems with St. Francis. That did not come from your agency. Information didn't come from your agency about those problems. In fact, when I looked back at testimony that we had received from St. Francis, that testimony wasn't even accurate. And there was no correction demanded by the Department of St. Francis. There was no correction provided legislators that served on that task force. And as you know, we have had several bills introduced this year, as well as prior years, just to try and wrestle and wrangle with the ongoing problems with DCF. So, and specifically with regard to foster care. So I will, for this committee, put back on the record what I shared with this committee last year when we had a similar hearing with regard to the merging. Quite frankly, I could support a change with DCF and KDADS if that meant pulling out foster care and forming that as a separate and then merging the other two together. But at this point, I do not see that the problems that we have within those two agencies are going to be resolved when we are concerned about issues of transparency, or when we're concerned about issues of responsiveness. Merging two large agencies to one will never solve the issues that we have, the deep-rooted issues we have with regard to our foster care system. Thank you, Mr. Chair.
Thank you. Committee, I will just give you an update. The House Appropriations Committee that did have the ERO hearing recommended the ERO go out as not to accept. So I'm not sure what the circumstances are. I just had heard that late last night. I haven't had a time to get into it. So I think before we would take any action, I would like to see what the circumstances were of that vote and how they came to that conclusion. So we are going to pass on taking any action today on this ERO. I can't say what we will do next week on it, but it'll depend on what I find out from looking at what happened in the House. I was wanting to work a few bills. We're running out of time, so I do not want to stifle any amendments or anything like that. So if it is okay with the committee, I will ask about a bill. And if you have any amendments, we're going to pass over it and wait for another day. If there are no amendments, if we can get it passed out, we will do that. The first bill that I would like to work would be Senate Bill 120. This bill establishes the Joint Committee on Child Welfare System Oversight. Were there any amendments that anybody wanted to offer? Okay. Seeing any, do we have a Senator Baumgartner?
Thank you, Mr. Chair. I make a motion that we pass out Senate Bill 120 favorably.
I have a motion by Senator Baumgartner, a second by Senator Thompson to pass out Senate Bill 120 favorably. All those in favor say aye. All those opposed, no. Thank you, committee. The second bill would be Senate Bill 77. Were there any amendments that anybody was wanting to offer on these? Seeing none, what's the will of the committee? Let me give you a quick refresher, sorry. This is the speech pathology compact agreement. Senator Baumgartner.
Mr. Chair, I move that the committee move out Senate Bill 77 favorably.
I have a second, or a motion by Senator Baumgartner, and a second by Senator Gossage to pass out Senate Bill 77 favorably. All those in favor say aye. All those opposed, no. Ayes have it, that passes out. The last bill would be Senate Bill 12. Do we have any proposed amendments on that one? I think there is some questions on that one because I do have a note, so I apologize. We're going to pull that one back and move over on that one. The next quick item of business, we're not going to, those are the only three bills I had that I wanted to work. The only other item of business is approved minutes for January 12th, 13th, 14th, 19th, 21st, 27th, and 28th. Everybody should have received those and had an opportunity to review those. Is there a motion to pass those amendments? Senator Baumgartner.
Mr. Chair, I move we approve the minutes from January 12th through January 28th.
I have a motion by Senator Baumgartner and a second by Senator Thompson to pass the minutes or approve the minutes from January 12th through January 28th. Any discussion? All those in favor say aye. All those opposed, nay. Ayes have it. Just one last quick thing before we leave. Please make sure you put your confirmation packet up here for Don Nolan. Thank you, everybody. We are adjourned.